Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. And today we're going to be talking about patient experience. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 18 years of health IT blog content at healthcareittoday.com. So I think I've been too much of a patient lately. I don't know about you. Have you have you been
I
to the doctor lately?
I have not in and so you're living the experience. I just happen to be going a lot of patient experience conferences.
That's good. We'll have both perspectives. So that's really interesting. But I would ask you, like, as we dive into this topic, do provider organizations really care about patient experience, or is it kind of lip service that happens at a conference?
You know, for years, if you had asked me that question, I would say it was kind of something that people just said they did, and then although they did put some dollars behind it, it wasn't serious. But I think that changed even before the pandemic. That changed. And part of the reason I think that organizations, why they do care deeply about patient experience, is they are finally realizing, they finally woke up to the fact that this actually makes a big difference in whether patients come back and
Mm,
whether they actually will choose your organization. Um, and this is, goes like before the joke was patient experience meant whether or not you had valet parking, right? Like, that was sort of the inside joke, but now no, it's all around, can I actually find a doctor easily? Can I book an appointment easily? Can I get a hold of someone easily if I need to ask a question? Do you send me reminders or not? Like, and then when I arrive, is it easy to find where I need to go? Like, all these things now are impacting decisions that are made by patients, and I think hospitals realize that that is the case. And so over the last 5 years, I have to say they have really been putting a lot of effort in this area.
yeah. I mean, I've probably said this on too many other people's podcasts that for a long time they didn't need to care. Like
Hmm.
they had enough, they had too much demand for their services, and so they didn't need to. But I think what you highlighted that I think is what's fundamentally changed is that patients have more options. They have more opportunity to go somewhere. And that's forcing the hand of provider organizations to say, hey, our patient experience does matter. Because if we don't, they are going to go somewhere else. And I don't know if that has to do with consolidation. And with all the consolidation, that's forced them to be more competitive that way because now, your competitors driving a better patient experience, I better as well. And so I don't know if competitive pressures are driving it. I don't know if it's, the high deductible plans that are, hey, I'm paying for this. Now I care about having a better experience because of that, because I'm footing the bill for it. Or if it's even just the ubiquity of the internet, which helps you understand that there are options, including telehealth options. Or, I even said this on a podcast recently. I was like, we have airplane flight to pretty much anywhere. Like flights to Vegas are really cheap. If you want bariatric surgery, you should fly to Vegas, get bariatric surgery, hang out in a really nice hotel, be treated, 5 star, and it's probably cheaper than going to your local bariatric person who's done 3 of them, right? Whereas the ones in Vegas are doing thousands of them. And so, like I think we've seen all of these shifts, which are saying, hey, if you don't, there are other options. And so maybe that's part of changing the mindset.
I think you're right. I think there's a lot of factors, right? Competition, right? We've seen, especially in some areas of healthcare, like around retail health, right? We know that the Amazons, the Walgreens, the Walmarts of the world are providing a level of convenience and experience that now patients are demanding of traditional healthcare providers. Um, there's a recognition also that when patients have a good experience, they pay faster. So that from a revenue cycle standpoint, there is a link, and people are accepting of that link. Whereas before, I think it wasn't proven, but now there is proven links to show when this happens, they pay faster, which is critical for healthcare organizations right now. But also, I think what they realize is, it's just a better patient experience actually improves the experience for everybody. Like your frontline staff have less irate patients to deal with. Patients are more vocal nowadays. They have more outlets to vent, right? They can vent on social media, that they're not being treated properly at a hospital. How embarrassing is that for a hospital to have to then recover from that, which means a lot more marketing work, a lot more executive work. So I think there's such recognition that, hey, like there's a lot of follow-on benefits that aren't just, more patients through the door. There's actually workflow benefits as well. So yeah, I really do think the care. I mean, you could argue, is it still a high priority? I would say it's still below things like cybersecurity and staffing issues, right? But it is on the priority list, and it may not manifest as purely patient experience, right? Like it's not going to be labeled this is a patient experience project, but things like protecting patient privacy, that's considered part of patient experience. Doing online booking, like or even doing something like a kiosk. Those things aren't traditionally thought as necessarily patient experience. Those are mostly done for like workflow reasons, right? And maybe some cost reduction. But they do help the experience overall.
I mean, you're bringing up an interesting point, and your comment about them paying if they have a better patient experience, that's fascinating. But I would, let's dive into that. Like, what is patient experience? You gave a few examples. I look at the patient payment experience and think, wow, that's your last memory of healthcare, and it's usually awful because you get seven bills and you're like, wait, is this the real bill or is this the EOB or is this the whatever? Like, is this what I'm supposed to pay or am I supposed to wait because insurance hasn't paid? And like what an awful patient experience that is, right? So, I mean, there's that. You add in, alerts in the room, right? The quiet, a hospital room. That's a huge patient experience thing that's definitely influenced by it. I mean, there's reasons those alerts are being put off. We see a lot of solutions in that, a lot of the messaging solutions, whether it's Perfect Serve or Volt, which I got it's acquired by Hill-Rom, or like all of these different organizations, Rollin, that takes all these alerts and makes it so they can be silent, but they still get to the nurse, right? So that's patient experience. The bed, the smart bed, the entertainment system, all of those are patient experience. How you check them in, like the registration process, what is that like? The discharge process, what is that like? Let alone in the ambulatory side, like you said, online self check-in. I had a great experience recently. I filled out the paperwork 3 different times, two electronically and one on paper. And it's because their system sucked and the way they did their workflow was awful. And then I told them, I was like, hey, I filled this out a couple times. Well, these forms are a little different. Well, first of all, if they're different, then go fix the electronic ones, like don't make me fill it out again on paper because it's different. Go fix the electronic ones so they're the same, right? Like that's the first problem. The second one was, and I was actually going in for 2 appointments. That's why I ended up doing it twice digitally. It's like you see that I have 2 appointments, like at least just tell me just to only do one. That's fine. But here's ironic, because I didn't fill it out and I was actually doing self pay, I didn't want to do my insurance. I didn't want them to know about what I was doing. And so I couldn't actually check in for the appointment because I didn't upload my insurance card and I didn't want them to have it. And I hadn't filled out the second form. And so they wouldn't let me check in. So the system was killing me, which should have made my life a better patient experience. It was actually worse. So anyway, how would you, what are some other things that you think patient experience is defined as?
I mean, I think everything you just said, John, and all the are touch on all the different areas that impact the overall patient experience, right? Whether it's the tail end revenue cycle stuff, whether it's the front end check-in, and then all the things in between. I mean, I often refer back to the Barrel Institute's definition of patient experience. So for those that don't know, Barrel Institute is a nonprofit organization that really is 100% focused on patient experience. I particularly like their definition. So I'm just going to read it here. So they define patient experience as the sum of all interactions shaped by an organization's culture that influence the patient's perception across the continuum of care.
Hmm.
So there's two key parts to this definition. One is the sum total of all interactions, right? So it at any interaction point, whether that's between the patient and the cafeteria, right? The patient and the payment, between the patient and clinicians, all those make up the patient experience. And the other key part of that definition is the patient's perception. So what's key here is it's not actually what you do, but actually how the patient perceives what you do. Because that is the key, right? Like, as much as we like to think that, the patients would appreciate X or Y, if they can't perceive it, or if they don't realize that's being done, then it doesn't impact them, right?
Yeah.
That's why I like this definition is it's got two key pieces here. And that's how I look at patient experience as well. It's all the interactions, and it's the way that the patient perceives those interactions across every point of their care.
Yeah, it's funny that you say that because if you give them a one pager to fill out as paperwork, they may still perceive it as an awful experience. When you're in your perspective might be, hey, this used to be 7 pages, right? Like, but
Exactly.
their perception could still be, hey, this is awful. That's fascinating. It reminds me also of a tweet I saw from Dr. Lewis, I think is his name. He's an oncologist, and one of his patients rated him 4 out of 5 stars. And in the review, in the note about this, it said, Dr. Lewis saved my life. And he's like, what am I supposed to do to get 5 stars? I saved the person's life. And I'd love to hear why they gave 4 out of 5 star. I jokingly said it's probably the food. The food was bad, and that's why I got 4 instead of 5, even though you saved their life and they still are giving you 4 star. So I mean, it goes back to it's the sum total of everything. If they couldn't find parking, maybe that's why they got 4 stars instead of 5, right? Or all this variety of things that contribute to the patient experience.
Well, and I have to say this, and this happened at the recent Barrel Elevate PX conference that I was at, and a number of other conferences too. Even companies like Press Ganey and NRC, they're talking about this. It's sort of morphed, John. It used to be 100% focused on the patient side of the experience, but all these organizations, these leading organizations, have started to add in a new element, and they've called it now the human experience.
Hmm.
And the reason why they've started to say that, is because there's recognition that good patient experience cannot exist without good staff experience,
Hmm.
right? If your staff are not happy, are not performing at their best, don't have the resources to perform at the best, then patient experience is going to suffer no matter what you try, right? And so there's a recognition that the human experience extends both to staff and the people that are providing the care, but also to the family and the caregivers of the patients. So it's more inclusive, in other words. So that before it used to be just focused whoever was in the bed, whoever was having the appointment. But now there's recognition that the experience extends well beyond that, and you need to make sure that those other people are well taken care of too, so they can then focus on the patient. And I think that's really again a reason why experience has expanded in terms of its scope, and why more healthcare organizations are focusing on this, because it now includes staff experience and clinician experience.
It's interesting you say that. I think it was a CIO podcast that I was doing recently, and they were talking about their new hospital, and it had bigger exam rooms, and it had a private area for the doctor to work, and it had a private area for the family to enjoy a little privacy and a little quiet time. And he's like, it's amazing the impact those things have had on the patient experience, because if the family's happy, that helps, right? If the doctor has a place to be able to do some work, that helps the experience. And it was amazing, that kind of, like you said, almost trickle down effect of, if you take care of the family and you take care of the staff, then wasn't it Richard Branson who said, I take care of my employees and they take care of the customers, right? I think it's a similar
That's
idea.
right. That's right. And hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're discussing the patient experience, which is a topic that we actually cover on our sister publication, Sway Health. That's Sway with 2 A's, .health. Over there, you'll find a lot of great content on digital front door, patient engagement, patient acquisition, and of course, healthcare marketing. Please go and check out Sway Health. So, John, let me ask you a question. What do you think are some of the main patient experience focus areas for provider organizations? What have you seen?
Yeah, I would say, I mean, you see a kind of a multivariate, right? Depending on who the person is. I think, on our marketing side, with a lot of our marketing people who are focused on patient experience, it's about that digital front door. What does that look like? How do I get them through the door? How do I make a great experience? How do I get the check-in process, clean? How do I ensure that they remember their appointment? Like, who would have thought, reminders for your appointment are actually part of the patient experience, right? So all of that digital front doors. And it seems like that is a major focus area for most healthcare organizations that I see. And I don't know, what's driving the demand. Is it the evolution of the tools as well? Because the tools have gotten a lot better. The EHR vendors have allowed for integrations that make it a better experience, along with it. So, I think we see that the digital front door on the one side. The other side that I see a lot of focus on is the smart hospital room, if you will, taking the room as you know it and making it, applying technology, sure, but also what does that experience seem like for the patient? How do we make it a great one for them? I saw that firsthand at HIMSS with Evidion and their smart boards, and of course their, the smart TVs that have the entertainment system and all that. Who would have thought that the board is such an important aspect of your experience? But if you've ever been in a hospital room, you should know that, because you sit there and stare at the board all the time, right? Because there's only so many things to look at, right? And so you're evaluating what's in there, and it can really impact the experience. And going to your point, for the staff who need the information when they go into the room, or for the, the patient that's there. And I think the other trend I see in that kind of smart hospital room is empowering the patient to be able to do more things. Hey, could you send me water? Could you send me, I need some more ice, whatever, right? Whatever request that they need, having the patient being able to do that. And then, of course, Evidion taught me it's routing it to the right person too, right? So it's not just, sending it to the nurse. Well, does the nurse need to bring water? No, there might be some other people that, are better for that, and let the nurse focus on the higher level stuff. So I think those are maybe the two biggest trends that I see.
I know a lot of in-room stuff for sure, right? I was getting a demonstration from the folks at OneView and PCare, and both of them have the capabilities that I know Evidion has as well, where it's a lot of patient education that's personalized, because they know who's in the room, right? And so right on the TV there, they can have options. Say, hey, when you go home, make sure to do these things, and here's a video on how you can do this once you get home. Here's the exercise that was the doc has asked you to do. Here's a video of someone else doing it, and you can do it, right? Like a lot of the stuff now is very personalized. And to your point, John, it's very empowering for the patients to be able to control, some things about their time in the hospital, right? Like, hey, like I don't want to visit right now. I really want to go sleep. Or hey, like I'd really like, this as my meal today. Just simple things like that can be very empowering. And a lot of these kinds of organizations are providing that in the rooms. For me, the area that I see a lot of investment is really on the upfront side, right? The digital front door, which includes one big thing, which is finding and matching to a doc, right? And so, I've seen a lot of demonstrations from Kairos, from ZocDoc, from other companies that, basically focus on this one part where if I'm looking for care, it starts to figure out who I am, where I am, what condition I have, and then starts to match me with a doctor, either within a system I'm looking at, but based not just on those parameters, but on parameters like preference, language. And I think that is really making a huge difference in terms of patient acquisition.
Mm.
Um, and so it's just more than provider directories now. It's getting into a lot of these AI matching and distance and figuring these kinds of things out. And I think that's making a very significant difference for patients. And then the last thing I'll say is, and I don't know why, maybe it's just the conferences I've been going to, but I've seen a lot of focus around translation services, and making sure that those are instantaneously available when they are needed right at the bedside. Right. So I recently got a demonstration from a company called Vita Talk. I've seen other organizations at other conferences, be able to offer these kind of translation services. So those are the kinds of areas that I've seen definitely a lot of presence, and which to me says that organizations are investing in those.
Yeah. That's interesting. I mean, I think there's so much opportunity that, and sometimes that's the biggest challenge for healthcare organizations right now, is like, where do I focus my energy and my effort when, I have 5,000 Epic tickets to address as well, along with all of the cool new innovations, the new AI, the chatbots that can be on the website, the check-in experience, so like there's so many opportunities. The question is, where do you focus? And I think that's maybe the biggest challenge that I see when I talk to CIOs, is like, yeah, there's a lot of opportunity, but I'm overwhelmed, right? Like, so where do I focus next? So I think that's the interesting evolution. You know, what has been the best patient experience that you've seen recently? Is there something you saw at the conference, or maybe you experienced as a patient, that you're like, yeah, that was a cool experience?
Well, I mean, as we started at the top, I've thankfully, knock on wood, have not had to make use of the healthcare system and recently, so I haven't got any personal patient experiences that I can talk to. But in terms of what I've seen and what I've heard at various conferences, I'll pick out a couple. One that I saw recently was through a company called Artria Health, right, formerly Well Health. So they provided an experience, and were telling me a story how they helped one healthcare organization realize that they were sending a patient 60 messages in a single day. This patient had multiple conditions, and we're seeing multiple specialties within their system and multiple sites within that system. We're going to multiple sites. And in one day, this person got almost 60 reminders and various texts for education and stuff, because each department would send like one or two, right? And it
Sure.
just so happened on this one day, it all coalesced into one. And you can imagine that's way too much of a good thing, right? Like, one day, one reminder, once a week or once a day, it's okay, but 60 is like overwhelming. And their system is able to detect this because they have a dashboard that looks over all the communications going to a single contact. And so they were able to flag this to the organization, who has now put in better governance to say, no, 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 guys, like, we got to set an upper limit here, right? And we're going to prioritize which messages actually go through to the patient. And then maybe we'll delay the other ones to other days or consolidate them. So, that was very impressive to me, because before, this kind of thinking didn't exist, right? But now that everyone's doing reminders, now this kind of technology is getting there, and Artria is one of the people that are really seem to have implemented it pretty well. So that to me was sort of an example of a good patient experience.
That's an interesting one. I take so many Southwest flights. Their alerts I don't even look at anymore. Like, their emails fall on deaf ears because I have so many flights. I have no idea what that notification, which flight that's even for. So I imagine the patient's in a similar situation where it's like, what is this even for? Like, it's hard to even process when you have that many. Interesting. I mean, I highlighted two already. The work that Evidion's doing with the smart board is just super fascinating to me, and creates a really great patient experience. It's amazing how much you get used to, like, a certain color or a certain logo to tell you information. And so it's interesting to see that done in a virtual setting, and the flexibility they allow hospitals to do. I think that's fascinating. And sure, the design of these new hospitals are really interesting to see. The hard thing is, like, well, how does that translate to the old one, right? Like, how do we do those same experiences in the older hospitals that weren't designed with patient friendly, family, et cetera, in mind? But there's one that, I'd say I actually had a bad and a good experience, and that was with radiology images. I asked, my son broke his arm, and we went and got the radiology stuff. And I said, hey, can you give me the CD? And he said, sure. So he gave me the CD. Then I went to the specialist. I said, hey, can you give me the CD? They're like, oh, we like to wait until after all of the radiology is done, because he has to go again in 2 weeks to get a check. I was like, okay, that's fine. For the record, I did break the first CD, but after I'd already copied it to my computer. So anyway, CD is not ideal. And the second one didn't even give it to me, so I don't even have the imaging. Well, then I went for an MRI myself that had my own, done. And I said, hey, can I get the CD? They're like, oh, it doesn't fit on the CD. I was like, oh, that's true. Can I get the images? Said, yep, you'll get a link. You can view it all online. And our friends at Pocket Health that are neighbors of yours, they do that as well. And I was like, how much better of an experience is that for me that they're just like, here's the link, you can have the imaging. And now, you know what I did? I was like, and I haven't done it yet, but I was like, I want to go ask for the other images onto this web platform. So it's all in one place, right? But it was like, that was just dramatically better because I want my images because I know that helps with continuity of care. I can go to my radiology friends, get second opinions. I can, I can do all sorts of things with those radiology images. But if they're stuck on a machine at the doctor's office that I'm not going to, I can't do that. So anyway, that was a good, bad, and beautiful patient experience that shows the whole spectrum of what's out there when it comes to patient experience.
Absolutely. And I have to give a shout out to John. You were just reminding me, I recently did an interview with the team over at Open Notes, right?
Mm,
And for years, Open Notes has been championing that same openness that you're talking about for images, but for the entire record,
yeah.
and mostly for the doctor's notes so that patients can access the doctor's note and see what the doctor wrote. And I know there was a lot of trepidation over doing this, but time and time again, the research that Open Notes has done has shown that patients don't freak out when they see doctor's notes, and it actually does not increase the number of phone calls. In fact, it decreases it, and it improves the overall experience that patients have, and they're better for it. Meaning they have better outcomes because they're able to understand what is being said about them and their condition. So, the Open Notes, has just created a new lab where they're going to be working on the intersection between AI
Mm,
and patient experience and patients in general, and also around sharing of that data. So you're absolutely right that, now we're bringing in interoperability into patient experience, but that does, you talk about the final step, right? Like after you've paid for your care, the real final step is now I want that information from, the image or the test results or whatever. And if that you make that difficult, which unfortunately it is in most cases, that will ruin what was maybe a very smooth experience up until that point.
yeah, absolutely. One other quick one that I had was a telehealth one. It turns out they were using Advanced MD. They had a nice Zoom integration. And to be fair, it wasn't as seamless as I would have loved. I had to wait for the join button. Wasn't updated. Is she coming? Did she have to call? What's going on? Is this going to work for me and my ex-wife? 'Cause we're both joining from separate places. So, but the good news is that it worked. Like, and we didn't have to drive to the office, and I was out of state and she wasn't, and it worked out fine. And so, like, shout out to them for offering that and making that available. Sure, we could still, improve some of the workflow and some of those other things, but all in all, I was really happy because otherwise I wouldn't have been able to participate in my son's care, and that was a powerful thing. So shout out to them for making it available.
Well, John, that brings us to the end of another episode. Thank you for those who tuned in to Healthcare IT today. You can find more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lynn. Thanks for listening and have a great week.